Hi, welcome to my show on Zuby Alive. I am Dr. Felice Gersh. I am one of a handful of fellowship trained OBGYN doctors trained in integrative medicine. What makes me different is that I have a much greater toolbox to share with my patients to help them to achieve and maintain optimal health, which is a foundation of having a happy life. Today, we're going to talk about a very, very serious issue. As you may know, May is National Stroke Month. And my topic today is to go over the basics of what a stroke is and a little bit about how to prevent a stroke and how it manifests itself. I want you to know that I'll be back to talk more about strokes on May 23rd and May 25th at the same time at 6 p.m., which is my time. I'm in California, so that would be Pacific time. So wherever you are, it will be your time. And of course, as you know, these shows are all archived, so you can come back and look at them another time or tell your friends about them as well. I want to tell you just a little bit more about myself and my practice. I am located in Irvine, California. I am the medical director of the Integrative Medical Group of Irvine. I have a small team of holistic practitioners. I supervise my team of naturopaths and fitness specialists and estheticians. And together we have, like I mentioned, a much greater toolbox to enable our patients to regain their health and maintain it once they have it back. Today, talking about stroke, just listen to the word and think about stroke. How emotionally empowered is that word? The very word stroke can strike fear into any person's heart, just to think about it, because when you get a stroke, assuming that you survive, which does not happen all the time. In fact, 60% of women will die from their first stroke. So, but assuming that you do survive, it often leads to a life of very severe disability, and that is not a quality life for anyone. So let's talk about what is a stroke. So the very word stroke is talking about something that happens very suddenly. And they actually talk about stroke in terms of the suddens. Suddens meaning like out of the blue, these symptoms occur. So what kind of suddens are we talking about? Suddenly, you have numbness on typically one side of your body, but that's not always the case. In fact, in women who often have atypical presentations of stroke, and I'll discuss that in more detail shortly, the numbness may not just be on one side, it may be on the entire body, but then one side may be more severely affected. So that's one of the suddens. Suddenly you get numbness or loss of sensation. What is another sudden? Suddenly you can't think straight. In other words, you're having really distorted thinking processes, you're confused, you're not quite sure where you are, you have a real distortion of reality, a lot of confusion. So suddenly your mental status changes and you're confused. That's another sudden. Another sudden is you can't speak properly. So suddenly your voice doesn't come out right, and your words don't come out right. You can't find the words. Your speech may not even be at all enabled. Maybe you can't talk at all, or what you say, other people can't understand. And there are cases where people have a stroke and they're trying to talk, but no one can understand what they're saying. It's like they're speaking an alien tongue. That is another sign of a stroke. And sometimes another sudden of a stroke is suddenly you lose your balance and you become very uncoordinated and you fall down or you just can't really walk. So that is another one of the major suddens. Of course, one of the other suddens, which is very catastrophic, is suddenly you completely lose consciousness, completely become unconscious. And that is another one of the suddens. So in terms of the way that we react to these suddens would be what we call fast. So this is very important to remember, fast. So fast would be, and this would be if you see this happening to someone else, Of course, if you can deal with this yourself, if it's happening to you, then you must call 911. But if you see this happening to someone else, you must react. And that is why they call this fast. So the first is F. You see something happening to their face. Okay, so their face becomes droopy. They're not like, if they smile, it's only one half of the mouth that smiles. So you see something changing. Their half of their face becomes droopy. So that's the first F. Okay, so we must remember that. And then we also must think about what is happening to their ability to speak. So if they cannot speak properly, then you must call 911. So if you see someone that loses their ability to have normal facial expressions, they cannot speak, and they lose their balance, please, you must call 911 immediately, because that is a critical group of symptoms that can go along with having a stroke. So what is it that's happening when a person has a stroke? The real medical term would be a CVA, cerebrovascular accident. Now, strokes come in two varieties, but the vast majority are of the first variety, which I'll describe, which are what we call ischemic strokes. So ischemic strokes is essentially the same thing as a heart attack, only to the brain. So whenever we talk about a stroke or a cerebral vascular accident, a CVA, we're talking about the brain. So when you have a heart attack, you have a diminished flow of blood and oxygen to the heart. When you have a stroke or a CVA, you have a diminished flow of blood to the brain. Now, the brain has a very critical brief span of time before it is permanently damaged. That's why fast reaction is so critical. And getting someone to the hospital very quickly is so important, because there are some amazing things that can be done nowadays to actually cause the damage from a stroke to be incredibly minimized or completely reversed. And there are cases where people go to the hospital and half of their body is completely paralyzed, they're completely disoriented, they can't speak, they can't walk, and they go through the treatment, which we'll talk about, and everything is completely restored. But there is this critical time frame that must be recognized. Sometimes people, they just rest. And I know specific cases where this has happened, where people say, oh, let me go lie down. One of the suddens that I didn't mention yet is a sudden, very severe headache. So if you have like the worst headache of your life, or someone says to you, I've never had a headache this bad, that can be a sign of a stroke. And often with a very severe headache, the kind that you've never had before in your whole life, the worst case headache ever, that is often a sign of the type of stroke that is a hemorrhagic stroke. So there's two types of strokes. There's the most common, which is almost 90%, a little bit less than 90% of strokes are what we call ischemic strokes. That is like a standard heart attack to the brain. You have diminished blood flow because of a blood clot. So a blood clot that is blocking the flow of blood. Now, in the heart, that can happen if a piece of plaque breaks off and travels downstream and gets lodged in a blood vessel that's too small for it to pass through, and then it acts like a dam. It just blocks the rest of the flow of blood, and blood delivers life-giving oxygen. So without oxygen, the heart will die. Without oxygen, the brain will die. So the same basic process can occur in the arteries that feed the brain. You can have plaque, like what we call atherosclerosis, which develops in the artery lining, inside the artery wall, inside the blood vessel, and that can form a plaque. And the plaque can become unstable. An unstable plaque can rupture. And if it ruptures, it causes a cascade of clotting factors to be released, which causes a blood clot to form on where the area of the blood vessel that ruptured open, where the plaque was. If this little piece of blood clot, if it breaks off and then travels downstream, just like in the heart, it can eventually get into an artery that is too small for it to pass. It will get stuck there and clog up the rest of the artery flow. And the blood that normally should go to the artery, from the artery downstream to the rest of the brain, will not happen. And that area of the brain will start to become what we call ischemic. It will lack oxygen. And if it doesn't get oxygen in a very short period of time, it can die. Now, some of it can be modified in terms of other areas of the brain can help to take over, but the brain will die. And there's a limit to how much the brain can recover from that. There's some amazing recoveries that can happen, but once the brain dies, everything is really never going to be quite the same again. It's really hard for a full, complete recovery. So we really want to intervene. Obviously, the goal is to prevent the stroke in the first place, which is what we're going to deal with in one of my future broadcasts on this series. But for today, I want you to know what is happening, what is a stroke, and how to recognize it so that you can intervene, whether it's yourself, a friend, a loved one, even a stranger, so that you can actually intervene quickly enough and potentially save their life, or certainly save the quality of their life. So ischemic strokes, which is like a blood clot blocking the artery, preventing flow of blood to critical areas of the brain, that's the ischemic stroke. The hemorrhagic stroke, which is only a little over 10% of strokes, is the one that's most commonly associated with the sudden, that we call sudden, severe headache. And that occurs when a blood vessel actually ruptures. Now, high blood pressure, which we'll talk about, can certainly be a precursor to ischemic stroke because it alters the health of the arteries, but it can also be a precursor to hemorrhagic stroke. A very high blood pressure in a person who has very rigid or stiff arteries can cause an artery to rupture. But the most common is when you have an anomalous artery. Like, so from birth, it didn't develop properly, and it forms a little balloon in it that we call an aneurysm. And this aneurysm is a weakened spot in the artery, which is more likely to rupture if you have high blood pressure. If you have pressure against this weakened spot, it can blow open. And it can sometimes happen just spontaneously after exercise or for whatever other reason, we're not sure, in someone who has an aneurysm in a blood vessel in their brain. And then it causes bleeding. The treatment for the two different types of strokes are quite different. And the only way to discern which it is, a hemorrhagic stroke or an ischemic stroke, requires a visit to the emergency room and to have advanced testing done. So in the event that it's the more common type of stroke, the ischemic stroke, in the hospital, some amazing things can be done nowadays. Once they actually confirm that it's an ischemic stroke, there are medications that can be given that are what we call thrombolytic agents. They actually can dissolve the blood clot. How amazing is that? Now, of course, there are some risks involved. You can get bleeding. That's why it's very critical to know that this is an ischemic stroke and not a hemorrhagic stroke, because you could actually then seriously make the bleeding worse. So that's why this obviously requires medical professionals. But once it is confirmed, and the window of time in order to give the thrombolytic agent, where it has a very good chance of reversing the damage and dissolving the blood clot, is only 3 hours. So there's really only a 3-hour window. That now sometimes it's expanded and they'll like give a little leeway, but really you want to try to intervene in less than 3 hours. So that's a lot that has to happen. The person who has the stroke has to be transported to the hospital. The hospital personnel have to, of course, recognize that this is a stroke, and then everything goes into high gear. The tests that need to be accomplished must be accomplished to confirm that it is an ischemic stroke due to a blood clot, and then the life-saving medication needs to be given. Another thing that's sometimes done in hospitals now, which is really quite amazing, is that they can localize where the blood clot is in the artery, in the brain, and actually go and retrieve it with little instrumentations and actually pull the blood clot out just intact. They can just extract the blood clot, allow the blood flow to be reestablished, and the brain gets all the oxygen it needs, and health can be restored. So this is where Western modern medicine excels. I mean, there's for chronic conditions, like, for example, dealing with all the predisposing factors, which we're going to be talking about in the future broadcasts, but talking about all the things that can lead up to having a stroke. Those are chronic conditions, and those are types of things that really modern medicine isn't very good at dealing with. They're mostly dealing with lifestyle issues, with stress, with sleep, with exercise, nutrition, and we're going to talk about all of those also in the upcoming broadcasts. But those are things where modern medicine is not very good, because there is no great drug. There just isn't, that's going to really prevent a stroke. Now, that said, I do want to emphasize that high blood pressure, which we deal with in an integrative approach, we deal with lifestyle, we want to get proper hormones on board. So there's much that we can do to try to prevent high blood pressure. But once somebody has established high blood pressure, there's still much that we can do to lower it. And we'll talk about that as well in the upcoming broadcast, because I have a big toolbox to help people naturally lower blood pressure. But whether you do a combination of the different natural approaches or you're going to use pharmaceuticals, it's really critical to have a normal blood pressure. One of the most predisposing factors, which, like I said, we're going to talk about this more, but I just have to talk about it today. I can't just wait for a future broadcast in case you miss the next one, is high blood pressure. High blood pressure is one of the really key issues that brings upon strokes. So it's very, very important to have a normal blood pressure, which is less than 120/80. We do not want a high blood pressure. Now, that said, in very elderly people, we don't want to push the blood pressure down too much, because then their blood vessels are often so inflexible that they become very lightheaded if they stand up, and can then actually lose blood flow to their brain and then actually faint or trip or fall down. We don't want that to happen. They could have a severe injury. So in the very elderly people, we certainly are not going to be extreme in terms of getting their blood pressure down. But for people who are younger, in their 40s and 50s and 60s, we definitely want to get their blood pressure down into a healthy range. Now let's talk about age. What is the age when people have a stroke? Well, many people think that a stroke is a condition that only happens to the elderly. But in reality, a very substantial number of strokes actually occur in people under the age of 65. And sad to say, in women who are pregnant, there's actually been an increase in the incidence of strokes. As a warning sign, and we'll talk much more about this as well, women who have problems with their pregnancies, like they get hypertension while they're pregnant, they get preeclampsia, they get gestational diabetes or full-blown diabetes while they're pregnant, those women after menopause have a substantially increased risk of developing a stroke. So this is really important to know. What we talk about as pregnancy being a vital sign. Pregnancy is a stress test of a woman's health. And if you have a complication in pregnancy, basically you failed your stress test and you may do fine up until menopause. And after menopause, that's when things really go awry and you do have an increased risk of stroke and also of heart attack. So let's talk a little bit about what a blood vessel is and how can it rupture. I just want to touch on this a little bit. So inside the artery is a lining that we call the endothelial lining. And we can actually look at this by getting a carotid intima media thickness test. So this is an ultrasound of your carotid artery. And this is really important that you obtain if you are certainly over 50. I think that's really important. Or even younger if you already have established hypertension or have some other problem, cardiovascular problem, because we want to know the status of your carotid artery. This is the main artery that feeds your brain. It's also a very sort of standardized artery. So what's going on in your carotid artery is going to be very indicative of what's happening in other arteries of your body. So if the intima, the lining, what we call the intima of your carotid artery is thickened or unhealthy, that increases your risk of developing plaque in that artery, which can then break off and potentially cause damage. And that could be in the smaller vessel. So we can't really easily access looking at the arteries in your brain. They're deep in there. We don't want to do invasive tests like angiograms as a screening test. That would be very invasive. So looking at the carotid artery is a good indicator of what's going on both in the arteries of your heart, in your brain, and in your legs, and in your GI tract, basically all over, because you can get problems with atherosclerosis, plaque building up in the arteries in your legs. And that's a problem that can cause claudication or pain when you walk. You can have it with the arteries that go to your intestinal tract, and that we would call an ischemic bowel. And that's like a heart attack or similar to a stroke to your intestinal tract. So, and if you get it to your legs, then that's peripheral artery disease. And of course, to the heart, that's a heart attack, and to your brain, that's a stroke. So the same process can occur all over the body, and we can help it in the same ways. And that we're going to be dealing with as well down the road in our last presentation on stroke on May 25th. But just in case you can't make that one, I just want to give you a little bit of information up front. And that is that to have healthy arteries requires that you have proper balanced hormones. And that's why women after menopause have so much cardiovascular disease develop. Women have more strokes than men once they hit menopause. Women make up 60% of all the stroke victims. Stroke is not a male disease. Stroke is a female disease. Of course, it happens to men, but women, 60% of strokes happen to women, and 60% of women will die from their stroke. The third leading cause of death of women are strokes. Let me give you an example. This is a true story. A relative of mine, I won't say what relative, in her mid-50s, developed a stroke. She could not use half her body. When she spoke, no one could easily understand her. She could no longer do the things she loved. She had a business where she was doing food preparation. She could no longer do that. She lost her job. She lost her business. She couldn't prepare food in the home. She couldn't do home chores. She could no longer drive. Suffice it to say, when she had that stroke, her life completely changed. Now, the happy story that comes from this, that's not the end of the story, is that she went through a great deal of rehab and was able to regain a fair amount of her function. And with an equipped car designed to help people who've had disabilities like stroke, she now can drive again. But she can't do anywhere near the things she used to do. And a woman in her mid-50s is really at the prime of her life. She should have so much to look forward to, taking trips and still being at the top of the heap in business. Women in the mid-50s are often very much at the top in terms of business, in terms of leadership. Certainly in medicine, women in their 50s are doing wonderful things. That's often the time when women are having grandchildren come into their lives. It's certainly not a time when any woman wants to have a stroke intervene. And I was talking about this video that I'm doing right now to one of my office employees just today, and she said, I can't believe it. I definitely want to hear that because my sister had a stroke, a significant stroke at age 58. So these are real life stories that really have tremendous impact on people's lives. I can share that my older brother, had a stroke a number of years ago, and it changed his whole life. He ended up having to retire. He was an active doctor, and just really had to struggle to have his life be anywhere close to what it was. So, and as well, my own grandfather, my maternal grandfather, had a stroke in his late 40s. He had what they called malignant hypertension. At this time, they had no drugs for high blood pressure. His blood pressure was very out of control. He had a massive stroke and lived for a few more years, very, very disabled. He was a brilliant, brilliant lawyer. And he ended up having a heart attack a few years later and died. But the last few years of his life after the stroke, and he was only in his late 40s when this happened, they were not happy years. So we have to really take stroke seriously. Stroke is the fifth leading killer of all people. And like I said, it is the third leading killer of women. It's only behind heart attacks and cancer. So stroke is a big deal. Stroke comes on suddenly. We want to remember all the suddens. When things happen suddenly, we must act fast. We must take action and call 911. Giving an aspirin will not reduce the impact of a stroke. It's not like a heart attack. So aspirin is not going to help. So remember the suddens. If you or a loved one or even a stranger, just a passerby, if they suddenly can't speak, if they have numbness or paralysis or decreased movement on one side of their body, even if they have numbness everywhere, if they have poor balance, if they lose speech capability, that's normal. If they have a severe headache, if any of these things come on the suddens, please take action, because if action is taken quickly, in a very significant percentage of cases, the severe damage from a stroke to the brain can be reduced or even completely eliminated. And I've seen that as well. I've had patients who've had a stroke, gotten to the hospital in time, had the proper treatment, and had no sequela. Absolutely as normal as can be. Now, I want to also mention what's called a TIA, a transient ischemic attack. Now, these are actually warning signs that a person may get a stroke. So it's a little bit like angina pain for the chest, for the heart. So people who get chest pain when they have walking or any kind of exertion, but it's not a heart attack, it's like a warning sign. There's some constriction of the artery, there's some reduced blood flow to the heart, that's angina pain. And for the brain, it's a very brief episode when one of the suddens occur. But it's very brief and it reverses. It reverses spontaneously. So suddenly somebody may feel numbness or confusion or balance problems or lack of ability to speak properly, but then it just disappears. That is never to be ignored. That's a TIA, a transient ischemic attack. That is a warning sign that you can be at risk for a stroke. Not all strokes have TIAs preceding them. In fact, many times they don't. Probably more often than not, they don't. But if you have a TIA, symptoms like that, you get one of the suddens, but they suddenly disappear as quickly as they came, make sure you report that and go right to the doctor, because if you're at risk for a stroke, there are things that we can do to reduce your risk. And this is what we're going to talk about in our upcoming broadcasts on the 23rd and the 25th. We're going to talk about the special populations that are at risk for stroke, what you can do about it, how do you help prevent a stroke, and what you can do just to be overall healthy to lower your lifetime risk of a stroke. Because if any of you have had a loved one who's had a stroke, then you will feel like me. This is an enormous issue, and we will do everything in our power to avoid strokes, and if it should happen, to do everything in our power to reduce the impact of that stroke on the person's life. Dealing with a stroke is one of the shining parts of modern medicine in terms of what can be done to reverse a stroke. So please make sure you act quickly, because it's a devastating condition which can change a life or end a life. So please, if you can, join me on the 23rd of this month and the 25th of this month to continue our story on stroke, while we, recognize the importance of stroke and give due diligence to prevent our strokes in ourselves and our loved ones. So once again, I am Dr. Felice Gersh, your integrative OBGYN doctor, women's healthcare specialist, here to help you to have a healthy and happy life. And have a wonderful evening. Thank you for joining me. Take care and see you soon.